Welcome to Headline Buster, brought to you by The Point with me, Liu Xin. In this series, I dissect stories that are making headlines around the world and talk to our panel to compensate for the missing pieces of the puzzle. Today, I'm asking, as countries around the world cope with COVID-19, why are some media still criticizing China's efforts and political system? Why not focus on what might work from China's experience in their own battles against the virus? Here's why I'm asking. COVID-19 is spreading around the world and spreading fast. Worldwide, over 125,000 cases have been reported in 118 different countries, territories and areas, according to the World Health Organization, or WHO, as of Thursday. We see cases erupting from Thailand to Togo, from Brazil to Belarus, and alarming spikes in Iran, the Republic of Korea and Italy, which now has over 12,400 cases. Outside China, the death toll has reached 1,440. The WHO on Wednesday officially declared the disease a pandemic, meaning a worldwide spread of a new disease for which most people do not have immunity. The situation has reached a new level of gravity. China has been battling the bulk of the cases so far, but in recent weeks, the situation has been stabilizing. The number of daily new confirmed cases keeps dropping and has stayed in the double digits over the last week, according to China's National Health Commission. And on Thursday, China only reported 8 new cases. Now, President Xi Jinping visited Wuhan on Tuesday, where he acknowledged that China's COVID-19 prevention and control efforts have turned the tide. The peak, according to a government official on Thursday, is over. The progress isn't due to sheer luck, of course. China has taken Herculean measures to fight and prevent the spread of this disease. Lockdowns, quarantines, specialized hospitals, mobilized medical teams, military transport planes. Slowly, people are able to go back to work, production is revving up again, and Beijingers are even happy to see traffic clogging the streets once again. Of course, some media have called China's efforts draconian, heavy-handed, autocratic, but we call them effective. And even now, when countries around the world are facing this new adversary, some media are still intent on painting China as the villain. In today's Headline Buster, I want to know, in their COVID-19 coverage, are media barking up the wrong tree? And my first example comes from the New York Times, and it was published early March, when it says China may be beating the coronavirus at a painful cost. The piece says Beijing says its heavy-handed measures are working. Can other countries battling the outbreak learn from its efforts, or is the cure worse than the disease? The headline is misleading, according to me. Although it asks, can other countries battling the outbreak learn from Beijing's efforts? Clearly, the journalist has no intention of really exploring this question, as she doesn't do in the article. She's already decided, it seems, that for the reader, the answer is a resounding no. Only once does the piece even bring up the issue, when it says countries studying China's approach would need to consider how it has upended nearly every corner of Chinese society. Instead of talking about what other countries could apply to their own situations, however, the piece uses the question to springboard into all kinds of criticism of China's system. China's campaign has come at great cost to people's livelihoods and personal liberties. Even countries that could copy China still have to ask whether the cure is worse than the disease, the article repeats. I just want to ask, how else do you stop the spread of a contagious virus, especially when you do not know how deadly it could be, especially when you see what happened in Wuhan? The journalist is fair to ask such a question, but she should have informed herself first. The article also tries to pull the trick of saying Beijing says its heavy-handed measures are working, and China says it has the answers, when, if you actually read the article, it's the World Health Organization who are saying this, not China itself. The WHO says China's containment measures may have saved hundreds of thousands of people from infection. Its efforts show that uncontrolled spread of the virus is not a one-way street, Dr. Tedros Ghebreyesus, the group's Director General, said on Thursday. There is no question that China's bold approach to the rapid spread of this new respiratory pathogen has changed the course of what was a rapidly escalating and continues to be a deadly epidemic. Dr. Bruce Aylward, the leader of the WHO mission that visited China, and he told reporters in Beijing late last month. And now, as the virus affects people in industries all over the world, from stock markets to tourism to the global supply chain, maybe people do want to know what could be taken from China's experience. Maybe now is the time for a little less ideology and a little more pragmatism. One last point here. Now, when the New York Times tweeted about China's lockdown, they focused on how the strict restrictions were coming at great cost to people's livelihoods and personal liberties. But when it comes to Italy's lockdown, the language totally shifts. In this case, Italy is risking its economy in an effort to contain Europe's worst coronavirus outbreak. More heroic than authoritarian, won't you say? The double standards are glaring, especially when these two tweets come minutes apart. Our next piece appears in the Wall Street Journal. Democracy, dictatorship, disease. The West takes its turn with coronavirus. It was published on March the 8th. Now, despite the melodramatic headline, the article makes some interesting points, however, I have to be fair. It opens by saying many epidemiologists and experts warn that drastic measures of the kind deployed in China and imposed in large parts of northern Italy on Sunday morning, measures that are so far opposed by President Trump, are now overdue. Overdue, that's the word used. Here we see experts' endorsement of China's so-called drastic or draconian measures that many politicians seem to dismiss, at least initially. But over the last week, things have started to change. Italy has locked down the whole country. Schools and universities begin to close across Europe and the United States. A containment zone has been set up around a hard-hit suburb of New York City. The NBA suspended the rest of its season. Healthcare systems are ramping up testing. It seems that finally, governments, businesses, individuals are starting to take note. Even if countries don't carbon copy China's measures, we see how some efforts can be adapted and customized for each country's system. The Wall Street Journal article adds, back when the epidemic was mostly limited to China, many Western politicians focused on the initial failings in Wuhan, asserting that the free flow of information in democracies will give them a natural advantage during a massive public health crisis. What is becoming evident now, however, is that such knowledge doesn't necessarily translate into meaningful action. Clearly, viruses don't care about your political systems. I only wish I could say the same about some media. So, is it even possible to report on the topic without turning political? I found a rather refreshing answer on Science, the publication by the American Association for the Advancement of Science. The headline from March the 2nd says, China's aggressive measures have slowed the coronavirus. They may not work in other countries. The article starts by describing some of the positive results coming out of the February 28th report released by a mission organized by the WHO and the Chinese government, and why the number of new cases reported each day has plummeted during the past few weeks. It also acknowledges that some experts had doubts about so much encouraging news before going to China, but says the experts agreed with the report when it says the decline in COVID-19 cases across China is real, and China's bold approach to contain the rapid spread of this new respiratory pathogen has changed the course of a rapidly escalating and deadly epidemic. The article actually follows up on its headline when it says, the question now is whether the world can take lessons from China's apparent success and whether the massive lockdowns and electronic surveillance measures imposed by an authoritarian government would work in other countries. Fine, call China's system whatever you want. But the article says China's methods might not work elsewhere, but it doesn't say they won't work because the Chinese government is authoritarian or whatever the way you want to call it. Instead, The piece focused on analysis from experts without editorializing or pushing an agenda. The overarching idea is summed up in the final paragraph by the World Health Organization expert when he says, we're getting new reports daily of new outbreaks in new areas, and people have a sense of, we can't do anything. Well, sorry, he says. There are really practical things you can do to be ready, to be able to respond to this, and that's where the focus will need to be. So, instead of using COVID-19 as one more opportunity to bash China and its system, why not focus on the global fight against this new threat? Let's all fight the virus the way you want, whatever you call it, but let's focus on the virus instead of each other.